We're going to record it. So eventually you can still listen to it or send it to your friends and colleagues. I'm Dr. Olusegun Joseph. We'll be looking at sudden cardiac death. Welcome to an hour with the cardiologist. We'll be looking at it through this outline: introduction, causes of sudden death, factors predisposing to sudden death, warning signs and red flags, and health implications of our past and current lifestyles. Sudden cardiac death is an unexpected death due to cardiac causes that occurs generally within 1 hour of the onset of symptoms in a person with known or unknown cardiac disease without any prior condition that would appear fatal. So this person has been hitherto fine, but some things happened, and within 1 hour, the person passes on. The person may be someone with a known cardiac disease, or the disease may not even be known, but it's actually, this death is from a cardiac origin, either known or unknown. Death of cardiac origin occurring suddenly in a patient that was fairly stable prior to the event. So I'm sure you would have heard of, you would have, possibly heard or maybe witnessed, I hope not, but I mean, some have witnessed it. Someone maybe in the board meeting that suddenly slumps, and then within an hour, the person is gone. Or somebody that was about, getting into his house and suddenly slumps, or about going out to work, suddenly slumps, or in, in the bank or driving or doing one thing or the other. The person before then was, stable to a very good extent. There was nothing suggestive of death in this person. And then an event takes off, the person deteriorates, and within 1 hour is gone. I mean, some will describe it that it was just like a film show. Some will say it was like a magic. Some will say, what? You mean the person I spoke to just 1.5 hours ago or 2 hours ago, he just left my office and things like that, and lo and behold, is gone. I was in a meeting, I think on Friday, a week or 2 weeks ago. Somebody went to the bank, wanted to, you know, withdraw money from the ATM, and while there, he slumped and he died, and that was all. Unfortunately, the phone, when the man fell down, the phone, fell as well, and the screen was shattered. They couldn't really get any, person to really call initially. But to cut the long story short, this person, was gone. All right. So sudden cardiac death is real, and we need to talk about it because it's increasing. Sudden cardiac death is not uncommon, and sometimes it is the first manifestation of heart disease. Somebody may be, going around with, undetected, undiagnosed heart disease, and the first symptom may just be sudden cardiac death. That's why we say that it's important that everyone at one time or the other should go for screening. I mean, just do your annual screening, cardiac screening and everything, and be sure that everything is well. And if there's one thing or the other that needs to be, dealt with, then you can present to the cardiologist or present to your, family physician and things like that. But please let us cultivate the habit of doing, annual screening at the least. Okay. I mean, thank God for good health, but don't take it for granted. Go for screening. All right. And you'll be, better for it. Sudden cardiac death is often the first expression of coronary artery disease and is responsible for approximately 50% of death from coronary artery disease. Coronary artery disease is, disease of the arteries of the heart, in which the vessel becomes progressively blocked, so to speak. All right, or progressively stenosed, becomes smaller, so that the passage of blood is reduced progressively, and before you know it, other things can happen. The person can have myocardial infarction or things like that. Okay, and then the person may even die. So sudden cardiac death is very, very common in coronary artery disease. Sudden cardiac death accounts for more deaths than deaths due to lung cancer, breast cancer, or acquired immunodeficiency syndrome. This is very serious. I mean, nobody will talk about lung cancer and not shiver. Oh my, you mean lung cancer is like a death sentence? But there is even something that is commoner that causes death much more than lung cancer, than breast cancer, than acquired deficiency syndrome, which means that we need to have a knowledge about it, and we need to see how we can prevent it. So sudden cardiac death is of public concern because of its increasing rate. And it's not only increasing in other climes, it's increasing even in Nigeria. All right, and that's why we need to talk about it. Now, there are so many medical terms when it comes to sudden cardiac death, but I'll try within this presentation to break it down to the barest minimum. So we will not be using some terms, and pardon me if I use some, I will explain them. I will give the layman's explanation for such, and then we can move on. It accounts for more than 7 million deaths per year globally. And 7 million is a lot of, of people. That's a lot of death even here. Sudden cardiac death alone, accounting for 7 million deaths globally. And in the United States, more than 300,000 deaths per year is as a result of sudden cardiac death. The low and middle income countries are not spared. It's increasing in these places, primarily because of changes in lifestyle and increasing risk factors and cardiovascular. So as our lifestyle changes, we're becoming more westernized, fast food, this one, salt, processed meal, and all the rest. And cardiovascular risk factors are increasing in Nigeria. We just finished talking about hypertension. We talked about it, for 4 weeks, and we all saw that hypertension has increased. I mean, hypertension is a real issue in Nigeria, just like it is globally. All right. So lifestyle changes, increasing risk factors, increasing cardiovascular, disease, and increase in sudden cardiac death. It is commoner in males than females, about 3-1. One, because obstructive coronary artery disease is commoner in males. Coronary artery disease generally is commoner in males. The risk factors for cardiovascular disease seems to be commoner in males than females. Just like we have said before, females have protection during the reproductive cycle, during the reproductive years. But when they get to menopause, the estrogen protection is lost. All right, that's one. Then there are some risky behaviors that predispose to cardiovascular disease is found more in males than females. The smoking of this world, the taking of recreational drugs. All right, it's still commoner in males, even though more females are getting involved, unfortunately, but it's still commoner in males. And as a result of that, sudden cardiac death is commoner in males. It's commoner in blacks. All right, and then we need to be aware of it, and we need to take our health very, very seriously. And it's common now with increasing age, right? There's also a type that is seen in athletes or the younger ones, and usually that occurs in people who have undiagnosed heart disease, either a congenital issue
okay, or a genetic problem, leading to some, heart disease that are not expressive until some of them just get expressed for the first time when the person suffers, this sudden cardiac death. So that's why it's a global practice that anyone that is going to will be involved in competitive sports should go through. I mean, will naturally go through medical screening. I'm sure those who follow football or some other sports, you will hear that, oh, he's completing his medical. So the thing that is remaining now is for him or her to do his medical screening. They're trying to see
and find out whether this person has any
cardiovascular disease or risk factors that can predispose to
sudden cardiac death. Of course, you've heard of people dying right on the field, maybe while jogging, while playing, while doing one thing or the other. It's usually a very devastating thing. We don't want it, and that's why these screenings are important. And I mean that also extends to people you have not been, maybe you have not been doing exercise before, and they now want to organize a sporting activity in your organization, for example. Please make sure you do a proper cardiovascular checkup, before engaging in it. Maybe you've not been exercising, you've not been doing anything, you've been living a sedentary lifestyle. Now they want to do 100 meters run, race, and you say, oh, I'm enrolling, I want to run. Please, before you embark on it, let them check your blood pressure. If possible, let them do your ECG. Let them be sure that you are fit to embark on such activity. Causes of sudden cardiac death. Abnormal heartbeats is number one cause. All right, globally, and it could be as a result of some underlying problems, or some underlying cardiac disease, or some other things that are not completely revealed at the time. So abnormal heartbeat is a major thing. For doctors in the house, I'm sure you can relate with ventricular tachycardia, ventricular fibrillation, atrial fibrillation, and asystole and all the rest. Okay, these are real stuff. So for us who are joining us who are not doctors, just know it that abnormal heartbeat is a cause of cardiovascular and death, sudden cardiac death. Myocardial infarction, also called heart attack. Now, I'm almost certain that there will be a question about what is the difference between heart attack and sudden death. All right, there is a difference. So heart attack can cause sudden cardiac death. All right, but heart attack is not sudden cardiac death, and we have spoken about. I think in the last edition, somebody asked that question, but because some people may be new or maybe attending for the first time, let me explain it. So sudden cardiac death as a result of electrical abnormality in the heart that makes the heart to stop. The heart stops. The person dies, so to speak. Dies, really, not just so to speak, dies. For some, prompt resuscitation can help bring them back. We'll deal with that one later on, But so the person dies because the pumping organ is completely knocked off. Heart attack is as a result of reduced or complete supply of blood to the heart, and that makes the heart to go through a lot of turmoil. So when the supply to that part of the heart ceases, there is complete cutoff of blood, and that part of the heart dies. That part of the heart completely can completely die. All right, and that can lead to death if somebody is if there's no prompt intervention. The heart will still keep beating. In sudden cardiac death, the heart stops beating. In heart attack, the heart can still be beating if it has not resulted in sudden cardiac death. All right, the heart will still be beating, the person can be resuscitated, but it can lead to sudden cardiac death. That's the difference. Is that a heart attack is as a result of blockage of supply of blood to the heart, or and that it can happen in so many ways. Okay, there can be plaques in the blood vessel that can rupture, and when they rupture, if the artery that has been slightly blocked before becomes completely blocked, and that causes complete cutoff of blood to that part of the heart, and that heart muscle, that part of that heart completely dies. All right, because there is no blood supply. All right, stroke can also cause sudden cardiac death. Yes, stroke is a neurological deficit, but the commonest cause of death in stroke is cardiac. And that's why it can be classified, as a cause of sudden cardiac death. Pulmonary embolism, that is blood clot leaving one part of the body and going towards the lungs and blocking, blood supply, all right, to the lungs, and in effect blocks the blood supply to the heart, because blood supply that it gets to the lungs will be oxygenated, and then from the lungs will go to the heart. If that blood supply is blocked, then there will be no supply to the heart, and the person can die. If there's no blood supply to the heart, there's no way the heart can supply the whole body, so the person dies. So pulmonary embolism, and we've had some people in the country that have had such. So, and I'm sure that you might have heard of people, maybe 16 hours flights, and then the person gets up to to go leave the aircraft, and while going, complains of leg pain, complains of of chest pain, and before you know it, they say the person is dead. That's pulmonary embolism until proven otherwise. All right. And then heart failure is also a risk factor because of sudden cardiac death. Ischemic heart disease, which can predispose to myocardial infarction, okay, is also a risk factor. So heart muscle diseases are also risk factor, are also causes of sudden cardiac death. So we have the dilated cardiomyopathy, in which the heart muscle is replaced by fibrous tissues. Hypertrophic cardiomyopathy, the heart muscle becomes extremely thickened, all right, exaggeratedly, and is beating abnormally. Arrhythmogenic right ventricular dysplasia or cardiomyopathy. Valvular heart diseases can also cause sudden cardiac death, aortic stenosis, mitral stenosis, and all the rest. They can cause sudden cardiac death. Congenital heart defects can cause sudden cardiac death. All right, both very complex ones, and the ones that may not be too complex, but have maybe some intrinsic things going on in the heart that is causing a lot of abnormal heartbeat and the rest. They can also have come down with sudden cardiac death. Aortic dissection, in which the aorta is literally split into two, so to speak. There's tearing of the aorta, and that can cause death on the spot. Okay. These are some of the things. So in summary, this picture summarizes almost everything. So we have coronary artery disease, which ischemic heart disease, and heart attack falls under the cardiomyopathies, the unknown stuff as a result of channelopathy and all the rest. Some genetic stuffs that are not easily detectable. Okay, valvular heart disease, primary arrhythmia, atrial fibrillation, ventricular fibrillation. Ventricular fibrillation, the person is as good as almost completely gone. Okay, ventricular tachycardia and the rest, ventricular tachycardia, myocarditis, pulmonary hypertension, pulmonary embolism, congenital heart defect. All right. Now, the risk factors. What are the risk factors for sudden cardiac death? Number one, abnormal heartbeat. We've mentioned it before now. The heart is just beating, in an abnormal way. It could be beating very fast or beating very slowly. Abnormal heartbeat. All right. It may be beating irregularly, okay, or beating in a way that, sometimes it will just beat very rapidly and sometimes we slow down and all of that, what we call tachycardia, arrhythmia, and all the rest. Abnormal heartbeat. So let's just put it, like that. Then hypertension, diabetes mellitus, dyslipidemia. Dyslipidemia just means, excessive cholesterol in the bloodstream in the body. All right. In such a way that the bad cholesterol is far much more than the good cholesterol. Sometimes the bad cholesterol may even be normal. The good one is extremely low. It's still dyslipidemia. Smoking, obesity, sedentary lifestyle, family history of sudden death. So if somebody has just died suddenly in a family, everybody in that family should go for a checkup. All right. Because some of these things are familial. Some of these things can run from, family to family. And we know if somebody dies suddenly, the other, the children, everyone should go for, full cardiovascular evaluation. It's extremely important. And dying suddenly does not necessarily have to be during activity. There is what is also called nocturnal sudden death. Somebody sleeps and doesn't wake up. It's sudden death. Everybody in that family should go for screening. All right. So family history of sudden death. Enlarged heart. Okay, if the heart is enlarged, okay, and there are some degree of enlargement that seriously predisposes people to heart attack, and to sudden cardiac death. And so, evaluation is extremely important. Prior history of left ventricular impairment. So the heart is not contracting well, the heart is weak, is not doing too well. Ejection fraction, that the measure of the strength of contraction of the heart is seriously reduced, like up to 30 to 35%. The lower it is, the more likely that the person is, may be, may suffer from sudden cardiac death. Background kidney disease. Most kidney diseases, especially as they advance, end stage renal failure and the rest, chronic kidney disease, most of them present with cardiovascular disease. Okay, cardiovascular complications are the cause of death, the commonest cause of death of kidney disease everywhere in the world. Sleep disorders, especially obstructive sleep apnea, okay, can also predispose to sudden cardiac death, because arrhythmia can come in, so many other things can come in. Obstructive sleep apnea can, coexist with ischemic heart disease, for example, can coexist with, arrhythmia and the rest. Because of the obstruction, there can be reduced oxygen supply, and that can, predispose to arrhythmia and so many other things. Drugs that can cause abnormal heartbeat, all right, are also risk factors for sudden cardiac death. Poor drug adherence. We talked about it in the last discussion that we had in the last meeting we had, when we talked about hypertension. Poor drug adherence is a major cause of sudden cardiac death, because if whatever is being treated is not controlled because of poor drug adherence, definitely that person is at risk. It's like someone opening his or her door or opening the gate late at night when, everybody is sleeping, opens the gate and goes to sleep. That is risky. All right, that is extremely risky. All right, so poor drug adherence is a major risk factor for sudden cardiac death. Recreational drugs, heroin, ganja, and all of those, stuff, cocaine and the rest, weed. These are risk factors for sudden cardiac death because they can predispose to, arrhythmia, to abnormal heartbeat. Increased intake of energy drinks. Energy drinks have a lot of caffeine in it. And I mean, if one keeps, taking it, there have been case reports of people who took energy drinks and slumped. In fact, one was reported by channels some many years ago. I think that was about 7, 8 years ago when this what are their names now? Those energy drinks first started coming into Nigeria. I think some people had a bet in the southeast, I mean the south rather, that they, whoever can, the fastest to finish 10 can of a particular, type of those drinks. And one of them, the moment it was gulping, it was on the 10th one gulping it, he slumped and died right there. I mean, and channels, reported it in their news, in their 10 o'clock news. Okay, so this is important. Energy drinks, okay, if you're going to consume, just please go slowly with it. And if you have issues with your heart, like we said, it's a risk factor for cardiovascular disease. Please run from it. COVID-19, in the presence of comorbidity, a lot of people, during the COVID-19, pandemic, died suddenly as well because, a lot of inflammation going on and a lot of sympathetic, a lot of release of hormones or substances that caused serious heartbeats, and those things made the heart to tire out. Some of these people died suddenly. So what are the symptoms that may precede sudden cardiac death? There may be no symptom, number one, and that sudden cardiac death may just be the very symptom, the first symptom of, someone with a cardiovascular disease. So there may be no symptom. Again, just like hypertension, it may present with very, very non-specific things, malaise, feeling unwell, and all the rest. And before you know it, the person passes on. More common, commoner features may be palpitation. That is awareness of the heartbeat. Okay, the person just feels the heart beating, please. That person needs to see the doctor. If you are in this meeting tonight and you find out that your heart just beats, sometimes like you are listening to this seminar now, maybe your heart is beating, you are not under suspense, nothing is going on, you are not running and things like that, no physiological cause, but it's just beating fast. Please, you need to see the doctor. Very fast or slow heartbeat, okay, that person needs to see the doctor. Blood heart rate of 40, 45, 32. I mean, the person is already feeling dizzy. Some will even begin to fall, having, blackouts and things like that. Please, the person needs to see the doctor. All right, chest pain, okay, especially left-sided or middle, or located in the middle. Okay, the person needs to see the doctor. Difficulty in breathing, easy fatigability, nausea and vomiting sometimes. Usually to come with palpitation, easy fatigability, nausea and vomiting. Sometimes the person could even be, very much sweaty, diaphoretic, and then there may be syncope, there may be blackout. All right, these are all symptoms that may precede sudden cardiac death. But again, like we said, it may not present with any symptom at all. So it's important that this is noted. What are the red flags for sudden cardiac death? Number one, family history of sudden death. We've mentioned it before. Symptomatic palpitation, that is almost every time you're aware of it. Once their heart starts beating, some people say once their heart is beating, it's like, oh my God, what's going on? Is this heart going to jump out? Please go and see the doctor. And not only see the doctor, see a cardiologist. Let them check you well. I mean, get evaluated so that if then there's a need for treatment, I mean, at that kind of level, there will be need for treatment. And if there's anything that is driving it on, the cardiologist will be able to help you to eliminate such things. Very, 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 very important. So blackout, syncope, falling, fainting, all right, fainting attacks, these are red flags. The person needs to see the doctor, preferably a cardiologist. Previous history of heart attack, previous history of cardiac arrest. Okay, so sudden cardiac death is also known as sudden cardiac arrest, because somebody may ask. So it's the same thing. So previous history of sudden cardiac death, that the person was revived because of a prompt intervention. All right, that person needs to take it slowly. One cardiac arrest can predispose to another. Previous history of heart failure. Okay, so heart failure either present or or at one time or the other. That's a red flag as well. All right, and that person needs to see the doctor and get evaluated and get treated. Okay, so 1 in 9 men will experience sudden cardiac death, most before the age of 70 years. This is quite disturbing, because if you get to the banking hall, you will see more than 9 men. So if 1 in 9 will have sudden cardiac death most before age 70, we need to take our health much more seriously. And about 1 in 30 women also have a higher lifetime risk of early death due to sudden cardiac death. Controlling cardiovascular risk factors, particularly high blood pressure, could reduce sudden cardiac death risk, and so many other things, smoking and all the things that we have mentioned before now. Let's stop here for now, okay, so that we can entertain questions. I thought we'll be able to finish everything about sudden cardiac death today, but we will not be able to do that, because there are 1 or 2 other things we still need to talk about, especially prevention. All right, so in the second part, that will be in 2 weeks' time, by God's grace, God's sparing our lives by God's grace, we will deal with sudden cardiac death part 2. So let's stop here for today. Thanks for listening. God bless you. If you have questions and comments, you can raise your electronic hand. The way by which you can raise your electronic hand is to go to, if you scroll down, the lower part, for those who are maybe new to Zoom, the lower part of your device, you will see something like more. No, you will see reaction. When you click reaction, you will see raise hand. Just click that. So I'm going to raise my hand now, click the reaction, and then you can see that there is a sign of my hand raised up. So you just go to reaction, click raise hand, and then your electronic hand will be raised. And once you finish asking your question, you can click that same thing. It will say lower hand. Once you click it, your hand will, your electronic hand will be, put down, just the way I have done. Okay. So if you have questions, all right, there are people that have questions. So Olufunke Akorede, and Falodun Lanre. Apologies, I don't know your appellation, so kindly pardon me for just going out of your name there. So please, admin, kindly host, kindly help us unmute these people so that they can ask their questions. Yes, please, you have the floor, Mrs. Olufunke Akorede. Please, you can go ahead and ask your question.
Thank you very much, sir. Good evening, all. Sir, my question is, for example, if somebody does not know that he or she has this cardiac disease, and after hearing a lecture like this, the person now goes to, to do a checkup and finds out that he has this disease, is it possible with doctor's treatments and the likes for the person to still live a long life? Because sometimes the notion of, a layman like me is like, if you have a heart disease, you are not likely to still live a long life. So that's my question, sir.
Okay, thank you very much. Maybe we should take two questions. Can you help unmute Mr. Lanre? I think if you still have a question, you can raise your electronic hand so that you can be unmuted. Okay, I can't see him. And okay, maybe before he does that, please admin, help us unmute our doctors, Dr. Bieli, Dr. Donny, Dr. Okogun, our cardiologist in the house. So, Dr. Bieli, do you want to answer the question that Mrs. Olufunke Adekorede asked?
Good evening, sir. Good evening, Mrs. Olufunke. Good evening, everyone. I'm not sure I got the question. I don't know. I got, because it was, please, can you repeat the question?
Okay, so she said that
because I was answering another question online.
Online. Oh, okay.
I was answering I was replying the questions online. The chat. Yes, sir. So I didn't.
Okay. So, Mrs. Olufunke, do you want to repeat the question quickly?
Yes, I can. Thank you. Yes, my question is, for somebody who just discovered that she has or he has the cardiac disease. Now, with doctors' treatments, if the person is going for regular treatment, is it possible that the person still live a long life? Like, to any layman, when you hear that you have a cardiac disease, it's like you have just received your death sentence that in a short while, you are going to die. So that's my question.
Okay, so having a cardiac condition is not a death sentence at all. So the issue is not listening to your doctors and not taking your medications as prescribed. That's where the problem is. So as long as you go to the doctor and you're checked out, you are investigated, and you're placed on medication, you should live as though you don't have any cardiac condition. It's just like you're just like the normal regular persons. Now, your doctor will also tell you what depending on the heart condition you're diagnosed with. Your doctor should also tell you what exactly you can do and what you cannot do. Like for some people, in terms of exercise, they can prescribe some certain types of exercise that you can do, and then some that you can't do, or the level at which you can achieve with exercise. So they'll tell you, oh, please do only moderate exercise. Okay, please don't swim. Please, okay, you can swim, but there has to be an instructor, someone watching, or you can do this. So definitely your doctor has to give you instructions on what and what not to do. Again, emphasis on you must take your medications as prescribed. As long as you take your medications and go for a regular checkup, you should be fine. A cardiovascular diagnosis or a cardiac disease is not a death sentence at all. You might just be like the regular person and nobody knows that you even have a cardiac condition and just live your regular life exactly the way you should. As long as you go for your checkup and then you take your medications as prescribed and you avoid everything that you're meant to avoid, including alcohol, smoking, and the rest. So you should be fine. Recreational dogs, you should be fine. Thank you very much.
Thank you, Doc. Very, very apt. Thank you so much for that. So just to buttress what she said, last week was okay. So today is Sunday. We're in another week. On Tuesday, I attended to a 92-year-old man. He's been hypertensive for quite a while. All right, but he's 92. If he doesn't tell you that he's hypertensive, you will never know. All right, but at the time he came, he was having a bit of difficulty in breathing. I saw him 2 weeks ago, and then he came last week for some cardiovascular evaluation, echo, and the rest. All right, and I mean, very, very, very fit. You wouldn't know. By the time he came there, I mean, last week, the difficulty in breathing had ceased because I just, took some of his drugs, and it was fine. Okay, so it's not a death sentence. That's on one hand. There are people that get diagnosed of one thing or the other, maybe hypertension, and 2 years down the line, they've already had suffered heart attack, or come down with heart failure, or even suffer stroke. If you check it very well, they've not been taking their drugs, and that's where that's emphasis on make sure that you take your drugs regularly cannot be overemphasized. Poor drug adherence is a risk factor for cardiovascular death, risk factor for any complication at all that you can imagine, as far as cardiovascular medicine is concerned. All right. And of course, not adhering to lifestyle, modification, and the things that have been the doctor have counseled the patient to do. Those are the things that get people to trouble. Cardiovascular disease, one can lead a normal life with it. Okay, thank you, Dr. Obieli. I hope that's understood, ma. Mrs. Olufunke. Any other question? So please, if you have question, just raise your electronic hand.
Thank you, sir. I understood the answer, sir. God bless you, sir.
Thank you to all who are, thank you, ma'am. Okay. Samsung SMA725. Okay. Falodun Lanre is raising the hand again. So, admin, kindly unmute Mr. Falodun Lanre first, and then the Samsung, and then Mr. Alex, in that order. Thank you very much, everyone. Just be a bit patient. You'll be given the opportunity. So once you're given the opportunity to unmute, please just ask your question. Please unmute Mr. Larry or Mr. Alex. Come unmute any of them. So for you to unmute, you will see something prop up. Host has unmuted you, or host asks you to unmute. Just click that button, and then you will be unmuted and you will be able to speak.
Hello, good evening.
Yeah, good evening, sir.
Alex, thank you very much. Thank you, doctor. I've raised a question on the chat box, but I'll raise it now. What happens if the patient is asymptomatic, that is, he doesn't have any symptoms of, but in the previous maybe examination, they've actually diagnosed the fellow to have some heart-related issue, but nothing has happened, is completely living very well, and no sign, no show that he has any heart disease or whatever. That's the question that I need.
Thank you. Okay, thank you very much. Dr. Okogun. Yes, thank you, sir. Dr. Okogun, can you unmute so that you can help us answer that question? Host, kindly help me unmute Dr. Okogun.
Okay. Hello. Good evening, sir. Can you hear me?
Yeah. Good evening, sir. Yes, we can hear you.
Okay, good evening to everyone.
Go ahead, please.
Yes, the question is, if the patient has no symptoms, doesn't need treatment. That depends on what kind of disease the person had. Most times, if patients, if maybe you are running tests or something for some other reasons, and you find a problem in the heart, yes, a number of times you want to monitor the patient and we want to run further investigation, and then we want to do some kind of analysis to see what is the risk of this problem leading to sudden cardiac death or leading to other complications. So by the time you do that analysis, you now see, oh, the risk of a problem is high. You may now want to start treatment. But in some instances, there are some inherited diseases that affect the muscles of the heart that the patient may not have a problem, but maybe you were just for whatever reason, or somebody asked for a routine scan of the heart, and you found that this person has this problem, and you think this person has a high risk of having a sudden cardiac death. You may need to treat, and treatment may not necessarily be tablets. It might just be that you put a device in the person's heart to shock the person's heart back to life in case the person has a sudden cardiac arrest. So it actually depends, but a number of times, a patient has a problem, has no symptoms, we just monitor, because drug is not as innocent as they all look. That's the way I like to answer that. Am I still audible?
Yes, you are. Thank you very much. Okay, thank you very much, Dr. Kogun. So,
sorry,
yeah,
sir.
go ahead.
There are a lot of questions on the chat
Go
box.
ahead.
Dr. Jennifer is answering a couple of them, but there are quite a number of questions on the chat box. I think we should also be looking at the chat box. So one, a couple of them, the ones I can remember now, I would like to attend to. Somebody's asking, what kind of food should somebody with cardiac disease eat? Yeah, it's not like diabetes that are strict, but there are a couple of rules too. Generally, we de-emphasize taking too much salt. Is it hypertension? Is it heart failure? We want you to eat, although it's difficult to measure the quantity of salt intake in this part of the world, but ideally, I think less than 2 grams or so in 24 hours. So, but I'm not sure we can do a lot of that. So, but you need to reduce your salt intake. That's key to a lot of cardiovascular diseases. 2, cholesterol, what we call bad cholesterol, bad fats. So we also de-emphasize that, issues of blockage of the blood vessels in the heart and, blood vessels in the legs and all of that. So we discuss some of the commonest sources of bad fats is red meat. And a lot of us enjoy soya so much. That's bad fat, actually. So we emphasize you eat a lot of seafood. We encourage poultry without the skin. And then, but I think that's about that. And then, of course, again, if there are other diseases that we think you need to put some hold on what you eat, we'll also do that. Then somebody talked about people with heart disease, can they live with drugs all the days of their life? To a large extent, the number of cardiovascular diseases require people having to be on drugs for life as the only way to keep it from getting out of hand or killing them suddenly. But like I said, there may be a couple in which you may need to use medications for a certain period of time. Either they are stopped, they are reduced. But many cardiovascular diseases, you need to be on drugs for life, or you need to be on a device for life. For instance, there are heart diseases in which the person's heart is too slow that the heart could fail anytime. They are given a device in their heart to keep up the heart rate. And they keep renewing it from time to time, even though if they are not taking tablets. So I think I would like to stop there. There are other questions in case other cardiologists will want to address. Thank you very much.
Okay, thank you very much, Dr. Kogun. Quite appreciated and very, very succinctly put. All right, so it's important that we know that number one, quite a number of cardiac diseases. Let's go back to that question. Quite a number of cardiac diseases are asymptomatic or risk factors. Diabetes may be asymptomatic for a long time. Hypertension may be asymptomatic for a long time. And like we said, even sudden cardiac death, before it comes, everything may just be asymptomatic. So if there is an asymptomatic cardiovascular disease or risk factor Your doctor will evaluate you properly and will be able to determine whether he or she should commence you on medications or not. And like we just said, the medication may not even be drugs, okay? May just be a device or one thing or the other, or even some counseling and the rest. But it's important that at this stage, the person should go for screening, see his or cardiologist, and let them evaluate, and then take the necessary step that needs to be taken for that person. Samsung SMA72, you can unmute your mic. Host, kindly help us unmute Mr. or Mrs. Samsung. Samsung, you can unmute your mic. I'm sure the host must have allowed you now. So just click that button on mute, and then you'll be able to speak to us. All right. So if you're finding it difficult, any other person who wants to ask a question? Dr. Donye, do you want to answer any of the questions or contribute to the ones that have been answered either on the chat box or the one that have been answered live? Kindly help me unmute Dr. Donye, please.
Good evening, sir, and good evening to the house.
Yeah.
Well, I think they've done justice to most of the questions that were asked, and the bottom line for what we just to reemphasize is to lay emphasis on taking our medications and ensuring that we also do our follow-up. Taking medications, I would say, is good, but also going for follow-up is also very important. There are times you're taking the medication and the dosage needs to be adjusted, but you think you're just fine with that particular dosage you're on. But you might need to actually visit your doctor such that you're evaluated, and if there's need to actually up-titrate the medications you're on, that can be done. Or there are times you even need to actually drop the dose of those medications you are on. So it's very important to take your drugs, but much more than taking your drugs, your follow-up is also very, very important. Not to assume that, tablet A works for me. Once I take it, everything goes away. It's important to take tablet A, but at the same time to also make sure we do our follow-up as at when due. And then, like it's been said earlier on, not everything goes with drugs. Sometimes it's just lifestyle adjustment, okay? Avoiding some certain food items, avoiding some certain drinks like we've been told today, the energy drinks for the younger age group where there could be use of illicit medications, so avoid such illicit medications. So basically, if there are issues with the heart, we should go with the counsel from your doctor. It will help and then go a very long way to make sure we avoid issues like this from popping up. Thank you, sir.
Okay, thank you very much. I don't know whether there's any other question. I think the chat box questions have been addressed. Okay, Dr. Obieli, do you want to help us answer this? My question is, if you experience, I think this will be the last, if you experience reduced blood pressure into the arteries, let's say 150/40, what can be done to bring it up to normal? Kindly help me unmute Dr. Obieli or any of our doctors. Okay, Dr. Kogun, you can unmute Dr. Kogun as well, or Dr. Kogun.
Yeah, hello, sir.
Please. Yes, please go ahead.
Yes, I actually wanted to
Go ahead.
address. I think two people ask about the same question on the chat, and I think it hasn't been addressed.
Okay.
I actually need to address that. Maybe I'll come to. I'm never sure of the question you asked.
Please go ahead. Please go ahead.
Yes. So two people are asking if you do exercise.
Blood pressure is low.
Hello? Hello, is it better? Hello?
Yeah, we can hear you. We can hear
Okay.
you.
Yeah, two people ask if you are doing exercise and you start feeling your heart beating palpitations, whether it's a sign of heart disease. And then the other one added, included, and then that you have to stop and all of that. The truth about exercise is one, exercise should be graded, or you do exercise you are accustomed to and then gradually increase. For instance, the first day you want to exercise, you want to run like Carl Lewis. You probably collapse before you get to where you are going to, because your heart is not accustomed to that degree and severity of activity. So you are going to feel your heart as if it's going to bounce out. And if you really don't stop, you could collapse. Not because you have a heart disease, but because your heart is not yet accustomed to that degree of activity. So for everybody, you exercise to a certain degree, your heart, you start feeling your heart beat. So that's important, first of all. So it could be that you are doing it, you are too fast. Your heart is not accustomed. You need to slow down and gradually build it. As you get accustomed to a certain speed or degree, you can now move on to the next step, and gradually, that's how it's done. But it could also be a sign of heart disease, you understand? Especially, you do something very little, something that is not different from what you should do, what you're accustomed to. You now start having palpitation, or just a little bit of an exercise. For instance, you are climbing staircase. Most people by second or third floor, they start becoming a bit uncomfortable, that they are breathing very higher, or they start having their heart palpitating. But before you even get to the middle of the first floor, the staircase, you're already having severe shortness of breath and all of that. That's a sign that there might be some heart disease. So it depends on the situation, but if it's really unusual, again, it's good to seek medical advice. I think that's what I have to say about the exercise part of it. Then, sir, the question you're asking, I'm not sure I got it.
150/40. What should the person do?
150/40.
150/40.
Yes, it's the upper one, the 50 is high, so that's abnormal. Then 40 also is low. Really, even as much as possible, we try to make blood pressure, if you have hypertension, target around less than 120/80. So that 140 is low for what we call diastolic blood pressure. So it's a sign that something is also not right somewhere. So both values are actually out of range, and you will need to see cardiologists to investigate. It may involve, of course, I don't know whether it's the first time the person is seeing it that way, or you're on treatment for blood pressure and it dropped that way. So the cardiologist need to see, are you in hypertensive? What's problem with diastolic blood pressure because of some things going on in the heart, or the blood vessels leaving in the heart, or the valves and all of that. So you need further evaluation, controlling the blood pressure, and looking for why you have what we call a very wide, the difference between the upper and the lower BP is so wide. There are medical conditions in the heart or blood vessels that can cause that. So you need further evaluation, but BP needs to be controlled, and we need to look for what's causing that wide blood pressure, and has to be managed. That's purely medical. I'm not sure we can go into other details. So you need to see a cardiologist to resolve that matter. Thank you. Thank you, sir.
Thank you so much. Thank you so much. That is just the answer to that question. You need to see the cardiologist. 150 pulse pressure is very high. So it is low than but you can contact is there on the chat box. Thank you, everyone. I think we've had a very Thank you, everyone. Hello, can you hear me? Please, if you can hear me, kindly, can you hear me? Please, if you can hear me, just put in the chat box. Yes, okay, thank you very much. All right, so we're going to stop here today.
This meeting is being recorded.
We're going to stop here today. Thank you very much for attending, and I hope you got value for your time. It's supposed to be an hour. Sorry, we started a bit late. We started around 7:19. It's 2018 now. I actually wish that we will still finish for 8, but questions kept going. But we need to round up now. Thank you very much. If you got value, you can just write something that shows that you got value for your time. We appreciate you. We will have the next meeting in 2 weeks' time, and that will be dealing with sudden cardiac death, treatment, prevention, and all the likes. Like we have been told, it's not all about drugs when it comes to sudden cardiac death prevention or treatment. There may be devices that needs to be put that will only be done in the environment of a hospital, and not just a hospital, but a specialized hospital, a specialized center where they can do that for you, for the person. Thank you so much. Have a good week ahead. We wish you all very, very sound health all through.